This one's for Mom and Dad. Mom and Dads, my name's Dr. Tim Conway. I'm a neuropsychologist, which basically means a brain scientist who studied how the brain develops from birth up through the ages, but then I also studied geriatric and brain injury, what happens when the brain gets damaged and you lose skills. So we've studied the dyslexia and the learning difficulties. We've also studied the alexia, the agraphias, which are acquired reading problems or acquired spelling problems. From that knowledge of brain development and brain injury, we've built a medical clinic called the Morris Center. The Morris Center is a transdisciplinary team of physician, speech pathologist, occupational therapist, clinical psychologist, neuropsychologist, recreational therapist, and many times educators who are all trained to work together. We do a comprehensive team-based assessment to understand where are your strengths and where are your weaknesses. We measure that across the academic skills and the skills that are the precursors to those. You're most focused on the academic skills, but where do they come from? They come from your language skills. So we're going to measure your speaking and listening verbal skills. They also come from your visual and motor skills. We're going to use occupational therapists and really measure the visual and motor skills like we use the speech pathologist to measure the language skills. And we're using the psychologist and the neuropsychologist to measure memory, academic, reading and spelling to understand the whole developmental picture of your child's strengths and weaknesses, or your teenagers, or yours as an adult. We can do this at any age. The specialty of the Morris Center is taking that transdisciplinary approach for assessment to guide what we do for treatment. Our expertise is to use the research that we've published, we designed, and we carried out, as well as our colleagues, to better understand what intervention program should we use to take this weaker skill and get it to match your other strengths. And then you have more strengths across the board. So the Morris Center is a transdisciplinary assessment clinic with transdisciplinary expertise in treatment to take weaker skills and make them stronger to give you, your child, your teenager, your college student, better ability to perform at their full potential. What we're looking for is not grade level. That's too low. Grade level starts at the 25th percentile. Rarely is your child going to have an IQ in the 25th percentile. Typically, they're going to be at least 50th percentile or above. So we're trying to get those skills to their IQ level because that's what really closes the gap that has been developing over time as they've been getting further and further behind. So we welcome the opportunity to work with you at the Morris Center to better understand your profile of strengths and weaknesses and to design a plan based on brain science that's going to help close the gaps, build those skills for long-term growth, and you're not going to come back and keep seeing us. This does not take years, it only takes months.